is dental sleep medicine, bridging dentistry and sleep medicine. I'm this is wait, wait. This is my brief introduction. I'm going to cover my today's talk under these contents. So, what is a dental sleep medicine? Nowadays, it is a rapidly growing discipline. In 2008, American Academy of Dental Sleep Medicine provided a definition for dental sleep medicine that it is nothing but the absence of the wakefulness. It focuses on the treatment of sleep-relating breathing disorders, including oral sleep apnea, do the methods like appliances and the surgery. That I already discussed that American Academy of Sleep Medicine defined it as a presence of any sleep stage apart from the wakefulness. If we talk about the epidemiology, you can see next to the China, India is the state where we have a maximum number of the apnea. There is a well correlation found between the hypertension, diabetes, especially the type 2 diabetes, between the OSA and these comorbidities. And in this, the India is on the second number. According to a study conducted in 2023 in the AIMS, in which they have targeted the subjects above the 15 years, and they estimated that an estimated 1,004 million working age Indians may be suffering from OSA, many of whom are undiagnosed. The common risk factors in the Indian population includes obesity, older age, gender, and the alcoholism along with subsedatives. ICSD given the classification, but being a oral physician, my domain is only the sleep relating breathing disorders. Under also the sleep relating breathing disorder, there is a huge classification, but my working domain will be the obstructive sleep apnea, both adult and the pediatric. Under the obstructive sleep apnea syndrome comes the OSA adult and the pediatric and the snoring, जिसको हम लेमैन में खराटे बोलते हैं. The most of the us they snore during the night, but we think it is a very normal, but no, this is not the normal. It is the first step of the initiation of the oral sleep apnea that later on leads to the fetal. So well, our whole life one third of our whole life they go into the sleep only. We have a different stages of the sleep, that is from non-REM to the REM, stage 1, stage 2, stage 3. Earlier the stage 3 was 3 and 4. So this is the way. From non-REM is we are just wakeful, we have not go into the deep sleep. From stage 2 we are just going starting into the deep sleep, and REM is the deep sleep. So N1 is the shortest sleep, and REM is the REM, and N2 is the longest sleep. So N3 and REM, they are 25 to 50% in our cases. So what are the physiological changes that go from N1 to the REM is the decreased breathing, decreased heart rate, and into the REM is the increased breathing and increased heart rate. So N1 they comprises of total only the 5% of total sleep time, and N2 only the 50, N3 is the 20 to 25, and REM is again from the 20 to 25. So whole sleep cycle is from 4 to 6 hours. At the time we sleep and we got up in the morning, it's a 4 to 6 cycles we go into the sleep. We have seen that the older people they sleep very early and they get up very early, so they are their circadian rhythm that is not the abnormal. Okay, then as the age increases, our hours of sleeping decreases. That's why as the older you have seen, most of us we have elders at our home, we see what they do. They sleep very early and they get up very early. So it is not, it is just related to the hormones. The age, as the age progresses, the hours of sleeping automatic decreases. So why the being a oral physician, why the N2 is important? Because most of us undergo the bruxism, the flattening of the teeth. That may be the awaked or the nocturnal, that the patient, depending on what the patient case history. And in N3 we undergo the in N3 most of the patient take the, whenever we take the tricyclic antidepressants, that increases, N3 increases. So most of us suffer from the OSA triad, who are so taking the tricyclic antidepressant. So what is the OSA triad? The patient, if they give the history, of bruxism, oral sleep apnea, and the GERD. So this is the OSA triad. So sleep is like the golden chain that binds our health and body together. So earlier in 2001, American Heart Association, they gave the simple way of living. But in 2022, they incorporated the life essential as a sleep. So now in 2022, it is the 8 simple life essential in which the sleep is the one of the main. So what is the effect of sleep on the general health? So common signs and symptoms will be snoring, irritability, personality changes, depression, fatigueness in the morning, GERD, morning headache, morning muscle fatigueness. So most of the patient give us the chief complaint of this ki I used to get up in the morning, I have lot of headache, I have the myalgia, so GERD. So that after taking the few questionnaire, we can diagnose the OSA. Before going to the sleep cycle of being, we should aware from the circadian rhythm, that is our 24 hours clock. At the time when we get up, at the time when the melatonin secretes, when the cortisol starts secreting. So that is very important for knowing our circadian rhythm. So this is the day and light cycle. So what is that? This is our eye, and this is our SCN. This is our pineal gland, and which secretes the melatonin. And SCN is the our boss for the maintaining our circadian rhythm. If our SCN is not working properly, we will not able to get up and sleep properly. When it comes the light, there is the inhibition of the melatonin, and when there is the night, there is the stimulation of the melatonin secretion. So melatonin is the hormone which helps us for to sleep better. And the right time for the secretion of our melatonin from the pineal gland is the 9 o'clock. 9 o'clock is the adequate time to sleep. So what I do in my home, I have placed the LED bulbs that is of the yellow color. So our brain now have an impression that it is going to be night right now. So SCM is directly targeted to the hypothalamus, then to the pineal gland which secretes the melatonin. So at the 11 o'clock is the second peak time for the melatonin to secrete. So that is the right time to go to the bed. So we have different biological clocks. Okay, one is the central and second is the peripheral. So the central clock, what is our master clock? That is the suprachiasmatic nucleus. So if our sleep is not proper, then our other organs of the area will be affected. So the heart will be affected, our immune system will be suppressed, our pancreas will be affected, our liver will be affected, and our brain will not work properly. That later on leads to the comorbidity. So the next is the internal examination looking beyond the 32. So everyone is aware from this handsome face, the Akshay Kumar. Do you know that Akshay Kumar too suffered from the oral sleep apnea? So what we can see here, we can see here the constricted maxillary arch and this triangular area. So that is the buccal corridor. Whenever a patient has a more buccal corridor, it means the maxillary arch is constricted. If the maxillary arch is constricted, our upper sinuses are also constricted, so we're not able to breathe properly. If we are not able to breathe properly, so we will definitely lay down into the sleep apnea or the snoring. The patient will also give you the chapped lips, this incompetent lips, hyperactive mentalis. So this is the buccal corridor. We have already discussed about that. So every one of us are aware from this, a good player shock. So we can well appreciate the constricted maxillary arch. He himself now is into a campaign that by organized by the Lilly. They work for the oral sleep apnea. Now you can see this is a 6 feet man, healthy man. So, but even though he is suffering from the oral sleep apnea, so it is not mandatory. If you are healthy, you can't sleep from the oral sleep apnea. No, if you are healthy, not healthy, that totally depend upon your circumstances of your pharyngeal wall, the musculature of your wall. How does it work? How does it respond? Elasticity of that. So the second one is a handsome Badshah rapper. He went from fat to fit because he too suffered from the oral sleep apnea. Our famous singer, Golden Man, Bappi Lahiri, he died from the oral sleep apnea. Now the one more, Arman Malik, who are the song freaks who loves to listen the songs. He is a good singer. He too suffered from the oral sleep apnea, and here I can see he is wearing the CPAP. So what are the other features that we will see into the oral cavity? We will see the crenation along the lateral border of the tongue. We will have these lines. Normally we don't have these lines. And you can see the constructed arch palate, the narrowing of the arch palate is there. So tongue tie will be there. Tongue posture, the patient will not able to touch the palate with the tongue. So there will be the anterior tongue tie or the posterior tongue tie. For this, it is mandatory to know the at which level the patient is having the tongue tie. For this, we use the Kotlow free tongue movement. So this is the way we measure the tongue tie. Okay. So first we measure the full mouth opening and then the tongue tie. Then we divide it. Then we get the Kotlow tongue movement. So this is the floor of mouth hole maneuver. What we will do, we will just put the finger near the floor of the mouth, and if we have a crater-like structure on the tongue, it means we have an anterior tongue tie. So this is the what I use in my clinic, in my institute, is this bifurcated instrument to hold the lingual frenum. So this is the other scoring methods that we use for the diagnosis of the oral sleep apnea. That is the Mallapatti scoring. This is for, although it is used for the endotracheal intubation, but here what we can see, we have to see the circumference of the oropharynx. Okay, here you can see the we can well appreciate the uvula. One third of the uvula is cut out, half of the uvula is not, and this the whole tongue is up, and our oropharyngeal has been constricted. So from where the patient will breathe, that will lead to the collapse. Okay, then here is the bronze sky. This is for the our tonsils. You can see this is the normal, and as we proceed, this is the kissing adenoids. Okay, so here we can see, we have to evaluate the nasal valve also. Can you see here? This is the normal wall, and here is the compression. If the compression is there, so that area will be constricted. So patient will not able to breathe from the second nose. See here, this is the nasal valve collapse. For this, we always use the chest investigation as the cordless maneuver. We will just place the fingers near to the nose, L of the nose, and we will just stretch it and ask the patient to breathe. Then we will compare how the patient feel pre and now the patient feel post after doing the cordless maneuver. That will directly leads to the a diagnosis of the constricted nasal passage. Okay, so this is the nose score that I use in most my cases as a chairside questionnaire. Then the adult measurement, we have to measure the mesiobuccal cusp of the first molar. So see, every time we don't have a patient, as I am in the government institute, every time if I will take so much time to for the evaluation of the single patient of OSA, my whole patient will suffer. So what I do, we have a cotton roll, that round cotton roll. I just place it into the palate. If that cotton roll get constricted, it means the patient have a constricted constricted maxillary arch. So for diagnosis, we have a basic questionnaire, chairside investigation, and a gold standard. So basic question is, have you been told that you are having known someone told you that you having the snoring? Do you wake up and tired? Do you have the headache? Do you have a difficulty in concentration? Because all the brain is affected, because I have already discussed in my previous slide what is the biological clock and what are the peripheral clock. Okay. Then there's the goal questionnaire. Then Epworth sleepiness questionnaire, which measure the quality of your sleep. Then it's the Stoke Bank, Berlin, and the PQ essay that tells about the quality of the sleep. So other type of the screening is also there. Nasal airway screening, nose, that I have already discussed. In the pregnant, the BATE is there, BATE questionnaire is there, pediatrics with the beers. And on my mobile, from where I have done the fellowship under the Rosamond University in the temporomandibular joint disorder, sleep apnea, and the myofascial syndromes. So they have given me a app. So this is very helpful for diagnosing the patient as a chairside. See, till the evaluation and the diagnosis is fine, but when I have some nasal obstruction, there I have to shake hand with the ENT specialist. So they are the different level of the PSG. One is the L1, L2, and L3. L1 and L2 will be the lab one, and L3 as the home. So there is the in-home study, that is the home set HST, and the PSG. So what is the apnea hypopneic index? So that is tell about the severity of the OSA. So this is the normal more than 5 episodes per hour, as it is an index. So all the indexes are taken as a per hour. Okay. Then 5 to 15, 15 to 30, and more than 30. This is the consumer wearables. That have you seen the Virat Kohli, Ronaldo? He is wearing a watch around their wrist. So most of thing there it is a watch. Now this is not the watch. This is basically to measure their sleep cycle. Okay. So level one is the basically the uh, that highly sensitive and the specific PSG that we use in undergraduates and the postgraduates teaching planning. How the treatment is advised depending upon the AHI, depending upon the comorbidities. For mild to moderate, myofunctional therapies is enough. Nasal hygiene is fine. In the severe cases, we go for the CPAP and then mostly to the patient we advise the CPAP and the BiPAP. CPAP is always put onto the nasal area, and the BiPAP is given to the nasal and the lip area. So CPAP is the only the we give the one side positive pressure, that is the nose, and in the BiPAP from the nose and the mouth both the high pressure will be good. We have few anti-snoring devices available. So that we also see the Shark Tank. Nowadays, a Shark Tank to have a pure flow. This is the strip just we will place on the nose, and that leads to dilatation of our nasal area. That's similar to the manual curtains. Prakash, it is because it is a enter sleep that will not let us to sleep. So whenever we have to work for the long nights, we go for the caffeine intake. That remains in our blood for the 6 to 8 hours. So whenever you are planning to go to the bed, don't bring the caffeine. So avoid the heavy meals, avoid the heavy walks, and don't put the strong lights before sleeping, because that inhibits the secretion of the melatonin. So this is my personal patient. More time will not take. So can you see here the constricted maxillary arch? See here constricted maxillary arch, and the uh, lingual indentations are there, and the constricted mandibular arch is also there. See the buccal corridor is very broad here. And see this tongue tie, anterior tongue tie is there. It's well appreciated anterior tongue tie. So this is the mandibular, how I measure the mandibular maxillary constriction is the way. Okay, this is my second case. This is the patient that come for the oral allergy, that is the oral lichen planus. But when I took his sleep cycle history, he told my sleep cycle is affected, and ma'am, I snore too. Then I took the stop bank, and that come to the low probability. What I saw here, can you see this constricted nasal as compared to, and the nasal valve is also collapsed in this case. See the oropharynx is also constricted, but his maxillary arch is proper. Okay, so these are the myofunctional exercises that I give to this patient, especially because it is a low, mild to moderate, not the severe, no comorbidity, so no need to go for the CPAP of the BiPAP because they are very costly. See, I am here in the government institute, so what I have to see, I mostly prefer to my patient which is not a heavy for their pockets, right? Because here we are for the patient well-being, not for their pocket well-being or our pocket well-being. Okay, this is the George gauge, with the help of which I used to take the impression for fabrication of a mandibular anterior devices. So this is a feedback from my patient after giving the So I give the myofunctional therapy to the patient. So 70% of reduction in his condition was there. Okay, so take home message is that snoring is a common sleep disorder. We should not ignore it. It starts basically from the mouth breathing, then to the snoring, and then to the oral apneas, and it is a fatal for all of us. So it is the right gateway to the sleep medicine. My today's lecture is that yes, sleep medicine can be bridged between the sleep dentistry. So it is a major burden, health burden, I would like to say, globally, which leads to the loss of the quality of life. So these are my bibliography. Laugh and world laugh with you. Snore and you will sleep alone. Thank you for your patient listening, and sorry for the in between interruptions from my side. And the questions are welcome.